Hello, this is Addiction Science Outreach. Today, we're going to help you understand the dangers associated with medication diversion. This lesson is for educational purposes only and should not be considered medical advice. Medication diversion is defined here as the use of any prescription medication by anyone other than the person it was prescribed for. Let's look at how this most often happens. One of the most common sources of medication diversion is unused medications. Some of these come from emergency rooms and dentists, where the doctors try to give you enough medication to make the pain from your injury or procedure tolerable. But no one knows exactly what your pain tolerance is. You don't even know. And it can vary, because when someone experiences pain, their levels fluctuate. Some days are better than others. Staying active or experiencing happy events can reduce our perception of pain. A bad event, like a death in the family or financial or other stress, can increase our perception of pain. Your doctor cannot possibly know exactly how much medication you will need, but they do their best. They prescribe a certain amount and ask you not to go beyond that limit. Your prescription might say something like, take 1 tablet every 4 to 6 hours as needed for pain, not to exceed 5 per day. For 3 or maybe 10 days for an acute problem. For a chronic problem, it will be 30 days usually. But if you have a really good month or even a few days and take the minimum necessary to make your pain tolerable, on some months, you will end up with a few extra. Some patients let these extras build up as a buffer in case they have a few really bad days or a new injury. And some think it's okay to go over their daily limit as long as they don't run out before their next visit. I want to strongly advise you on 2 important points. The more medication you take, the less effective each individual dose becomes. Tolerating the maximum amount of pain that you can while still maintaining a reasonable quality of life will do better for you long term. Some people are even able to get off pain medications completely, even with severe chronic pain. But just because someone can do something does not mean everyone can do the same thing. And you won't know if you can unless you try. The important thing to remember from this lesson is that those extra pills you might end up with at the end of the month are a danger to you, everyone you love, and people you don't even know. So rule number 1, destroy all extra medication at the end of treatment, the end of the prescribed period or the end of the month, whichever it is, in accordance with the instructions from your local pharmacy and physician. Rule 2, keep all of your medications securely locked up, where they cannot easily be accessed or stolen. The next issue we will discuss concerning the diversion of prescribed medications is the influence of family and friends. It is hard to see someone you care about suffer, and when friends and family know that you have strong pain pills, they will sometimes ask to borrow a few. You must remember to set an absolute rule that you don't ever let anyone have a single one of your medications. Not even a single dose, not even just once, not even if they are on the same medication, and that last sentence is very important. Friends and family will sometimes get into the habit of loaning each other a few pills when someone is having a bad week, with the understanding that they'll be paid back later. But know that you are not doing them a favor, and they are not doing you one. If your pain medication prescription is not sufficient to make your pain tolerable, to the point that you can have a reasonable quality of life and carry out your necessary daily activities, tell your doctor. Only by knowing this and taking it into consideration can your doctor prescribe the correct amount of medication for you. The same goes for your friends and family. If they are not able to manage their prescriptions as written, you are not helping them by allowing them to use your medication. You are enabling them onto a path of certain destruction, not just for them, but for you also. Because once you give in and give them a single pill, they will never leave you alone until you give them just one more, and then one more again. And then you end up trapped in a vicious cycle. Giving in to their demands could leave you hunting for someone else who has extra. And let's talk about where that leads. Inevitably, if you start sharing medications with others, a financial inducement comes into play. A friend might say, "Thank you so much for being there for me. It's just a really hard time and I appreciate it. Let me pay you a little something for your trouble, just to show my gratitude. If you accept this payment, you have now gone from compassionately caring about the suffering of another human being to accepting a financial reward for diverting your medications. You are now legally a drug dealer, and everything you love and care about, including your personal freedom, will be destroyed. I say will be, because you need to understand that when people are out selling and buying prescription medications from each other, people will know. It probably won't be your doctor who knows, but it will be the other users, other sellers, and especially law enforcement. They will know. In fact, your doctor might be the last to know. Your doctor is spending all their time trying to stay current with advances in medical science and practice. Only a very few of them will be spending any time anywhere near the street, or they might even have an opportunity to know. And those probably have substance problems of their own. Now, doctors are usually compassionate people. They judge each other and themselves by their ability to understand medical science and ease the suffering of others. Good doctors are not usually by nature suspicious people, and with good reason. The doctor-patient relationship requires trust, and seeing every patient as a probable liar is not conducive to a good relationship. You must be able to speak freely to your doctor, and they cannot act like a policeman, and they should not, as this would destroy the practice of medicine. Law enforcement officers, on the other hand, have a very different perspective. They spend their days seeing the worst of human nature. They are not shocked when someone does something selfish or even evil. Just like emergency room doctors will see hundreds of people die over their careers and must accept that they can't save everyone, law enforcement officers must accept that pretty much everyone is capable of deception and wrongful behavior under the right circumstances. And these officers are on the street, or people working for them are. And if you know where to go to get a few extra pills, I guarantee you law enforcement does too. And if that place to get extra pills is your house, the only reason you are not behind bars is because they are watching to see how many other people they can get at once. If one of your friends gets arrested and you don't, it's not because you are lucky. It's because the authorities just didn't want you, at least yet. Don't think that because you can fool your doctor, that you can fool them. Doctors are not trained like they are. And they don't see the world the way law enforcement does. And understand that anything you do wrong can bounce back on your friends, family, and doctors. The doctor's honest efforts to ease your suffering and to be understanding will be interpreted as not caring about diversion or being willfully blind. Law enforcement doesn't understand that doctors cannot be both healers and enforcers. Now, one last thing, and let me be clear. I have felt severe pain, but I do not suffer chronic pain. I have felt anxiety, but I do not suffer chronic anxiety or panic attacks. In fact, because the perception of pain and the experience of anxiety are so individual, no one will ever know exactly what you are going through. Not your friends and family, not the politicians and police officers, not even your physician will ever completely know what you are suffering. That does not mean that we cannot help you through this and get you on a path to a healthier and more fulfilling life. Please, listen to your doctors, follow their instructions, safeguard your medications, and do not keep extra. Do not become another casualty in the war on people who use drugs. Almost 1 million people are gone so far. Don't let the next one be you or someone you care about. Please feel free to leave a comment here, and if you have a question, ask it. I promise we will respond to every one. Thanks for listening. Stay safe, and remember, no life is beyond improvement.